Doctors of Reddit, what was your dumbest Iamverysmart patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds. Diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes and he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams no, no water. He's allergic to water. Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32-ounce soda every day. I ask her if it's regular or diet, and she replies with it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke, Kool-Aid, sweet tea versus those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. No way. That stuff is poison. It will kill me, mom. Your A1C is 14. Sugar is already killing you. I had a patient who was a completely non-compliant diabetic, smoker, morbidly obese, who had his first heart attack at 45. His blood pressure was also super high, and instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was Savine powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Had a neighbor in rural TN who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it, and that doing it in an enclosed living room while smoking cigarettes was acceptable. She was baffled when CPS took her kid away. 70-year-old female tripped and fell 2 days ago. She came in with hip pain, but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior, her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative no, you are wrong. Just stop it. This has got to be the medical equivalent to the update you installed on the computer a year ago is making it run funny. Get over here and fix it. I work for an optometrist, and it was the month before school started and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the moment she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all a con artist trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion, and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needs glasses. Not a doctor, but I'm a nurse who worked in the OR at a trauma center, was doing surgery on a 19-year-old who tested positive for MNC, who was grilling the anesthesiologist about every drug we were going to use in surgery because he doesn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO Coke. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children. Thinks it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart attack. My favorite ever story from a colleague. A patient comes into A&E with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." I've got two stories that stick out in my mind. The first is the mother of a toddler who came into emerg. The kid had cruddy green bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mum was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But Mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big Olay button battery. It would have been burning his nose for a couple days. Hopefully he healed up well. Side note, if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a D&C so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with higher levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She said, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, "We don't know why you have these constant high levels of HCG in your blood and we are worried." Patient inquiring about birth control was adamant she wanted an IED. I mean, she probably wouldn't get pregnant after that. Had a young woman with recurring UTIs that began after a recent partner and with no STDs. Went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricating with jelly, not KY jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Oh lord, I'm British so didn't think jam straight away and was just imagining someone trying to get jello type jelly to stick to their bits. Oh, I have two good ones that come to mind. Clinical pharmacist here BTW with one story in the ER and one in the pharmacy. A physician told me this one. 16-year-old boy presented to the ER with an extremely swollen discolored penis. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. His penis was terribly infected and he was hospitalized for a week or so. Frick, that is just gruesome. I work in the ER. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house. so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Between the guy putting arm blood into his penis and now this, I don't think I'm gonna see my genitals again for a couple of days. I'm a corpsman, not a doctor, but I once had a patient tell me that there was no credible research that smoking was bad for one's health. Okay. 80 plus YO. Patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all. BTW. At some point you kind of have to stop being polite and just tell patients' family members bluntly that you don't have time for this crap and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. I am a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal number? I need you to move your head right. Hey doc, are these cavities being caused by the anaerobic pathology microbes number? They are caused by you eating snacks all day and not brushing." A patient was admitted for anemia and a localized cancer was found. She was referred to surgery so she can get cured from her localized cancer, and she started telling everyone that it was the doctors who caused the cancer and that she was doing just fine before coming to the hospital. She lectured the surgeon and my colleague, who pleaded her to get her surgery so that the cancer doesn't advance, and yet she refused, saying she knew better and probably didn't even have cancer. Some people. This kind of reminds me of my brother. He told me that when he was younger, 5 or 6 years old, he thought that when a doctor diagnosed you with a disease, it means that they actually gave you that disease. The only difference is, he quickly realized this wasn't the case and didn't become a freaking idiot like this lady. Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence. New fathers and mothers asking me what's wrong with their newborn son's penis. He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision, often followed by a parent's question, "What's circumcision?" That's when I face palm. Dead serious. We talked about circumcision in my grade 6 health class, but saw any pictures. I had absolutely no idea until I was in high school. I knew what it was but had nothing to compare it to. This was pre-Google. Was working at a pediatric urgent care. Family brings in their 3-year-old unvaccinated son with autism for a weird rash. They couldn't give me any reason why when I asked them about his vaccination status. Said it before, I'll say it again. Had a patient insist I didn't have a heart attack. I had a myocardial infarction. That's just the technical term for a heart attack. Genius. Patient had an anoxic brain injury from drug overdose. She was 23. Her father demanded a brain matter transplant and oxygen directly put into her brain to fix it. But then he decided they would trash and peg her, send her to a nursing home, and wait for a cure, because we didn't know what we were doing. I was a unit secretary and nurse aide on a radiation oncology unit in the early 2000s. We had a patient show up through the year and was admitted for emergency radiation treatment. She had a massive fungating mass in her mouth that had consumed half her head. When the radonc doc tried to examine her and open her mouth, her remaining teeth fell out into his hand. It had eaten through the bones of her face, invaded her eye socket, everything. Doc said it was the worst case of mouth cancer he'd seen. According to her husband, she had a small lesion on her hard palate, and upon receiving the diagnosis of an early-stage squamous cell carcinoma, she decided to treat with essential oils and things like frankincense because chemo was poison. Her husband said he had tried to reason with her, but she was adamant about the natural treatment. She died in agony shortly after. You know, I usually adamantly refuse to allow my happiness to be disrupted by stuff on the internet. But it's stuff like this that makes me feel justified in allowing myself to be triggered when I see someone I know on Facebook posting horrible misinformation from somewhere like Natural News. ORN here. not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He's admitted to the floor and gets IV antibiotics. What? I've seen enough of Reddit today. You have been spotted by the rare flying floofer. If you comment good boy below, he don't steal your hot dogs anymore. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.